Hey there, PT World. Welcome to the first episode of PT Curate. What I'll be doing is going over some articles that I found over the past week that I think you might find helpful for your own interests or to direct your patients to. The first article is from PT in Motion News, and they give a statistic that nearly 1 in 4 adults in the United States has arthritis. They go on to direct you to a toolkit that was created by the Osteoarthritis Action Alliance, the U.S. Bone and Joint Initiative, and numerous other experts in the field. The toolkit's called the Osteoarthritis Prevention and Management in Primary Care Toolkit. There's a link on that website that I'll provide below that will show you 9 different modules that you can look at for your own information and also to direct patients there so they can better understand what's going on. And if you didn't already know, we missed it, but October 12th was World Arthritis Day, so yippee. The next article is from Medical News Today, and it's titled Vitamins B6 and B12 Linked with Increased Risk of Hip Fracture by Tim Newman. So most people can have a good amount of B6 and B12 in their diet and don't necessarily need the vitamins. There was a study done recently that showed that there's a higher risk and fracture rate in individuals taking both vitamins B6 and B12. Scientists saw a relationship between B vitamin supplementation and the risk of hip fracture. The risk was highest in women with a combined high intake of both vitamins, exhibiting an almost 50% increased risk of hip fracture compared with women's with a low intake of both vitamins. The exact reasoning for the increase in hip fractures with high intake of B6 and B12 is unknown. One theory the author outlines is that high levels of vitamin B6 may accelerate bone loss by counteracting the modulating influence of estrogens on steroid receptors. Vitamins B6 and B12 are often found in meat products such as fish and beef. Now let's head over to PubMed and read some abstracts. The background of this study was on chronic ankle instability, which is a common disease following ankle sprains. This study was aimed to examine the effect of therapeutic exercise performed on C-SAND for pain, fatigue, and balance ability in patients with chronic ankle instability. The conclusion of the study was therapeutic exercise on C-SAND effectively improved balance and decreased pain and fatigue. Thus, it can be considered a rehabilitation method for chronic ankle instability patients. I'm not sure why they didn't go with patient first language there. Am I right? Anyway, they mentioned C-SAND a few times. Not exactly sure what C-SAND is. I would just think it's normal sand. But for more information on this, please head over to the link below, and that'll take you to the PubMed study. Sticking with abstracts, we are now going to look into the feasibility of blood flow restriction exercise in patients with incomplete spinal cords. The background is blood flow restriction exercise, which already has shown promise in the able-bodied population, may be a novel method for improving muscle function in the incomplete spinal cord injury population. Looking at the results, all subjects were able to complete each blood flow restriction trial without showing signs of autonomic dysreflexia or DVT formation. No differences were observed for pain, perceived effort, muscular activation, or lactate between blood flow restriction and control exercise. Mean arterial pressure and systolic pressure both increased with exercise, but were not different between conditions. Oxyhemoglobin and deoxyhemoglobin saturation both increased during blood flow restriction exercise, whereas tissue oxygenation index decreased. These results suggest that controlled blood flow restriction exercise can be safely performed by individuals with incomplete spinal cord injuries without added cardiovascular strain or heightened pain. Last but not least, we are looking at a systematic review on PubMed titled Preoperative Quadriceps Muscle Strength and Functional Ability Predict Performance-Based Outcomes 6 months after Total Knee Arthroplasty. And again, this is an abstract. The background states that objectively measured performance-based measures provide a less subjective approach to informing patient treatment after total knee arthroplasty. However, information about predictors of functionally relevant performance-based measures is scarce. There is low-quality evidence existing for an association of preoperative functional ability and quadriceps muscle strength with functionality at 6 months after a total knee arthroplasty, Thank you for listening to the first episode of PT Curate. That was for the week of October 14th. Please subscribe and like the video if you enjoyed it. Next week's episode will come out next week.